This is Amy Dempsey at Magnolia Regional Medical Center. I'm the EMR administrator. I'm going to give you a brief overview of how to use our EMR. Um, I'm going to leave all of your login information in the office along with your door key to get in the door if there is one. Also, I'll leave you my cell phone number, so if you need to call me, you can also FaceTime me and I can walk you through any problems that you may be having. So the first thing we're going to do is click on the E for Evident, and I'm going to log in with my test physician. I will have the information and your password here. When you connect for the first time, always hit the word connect. Even when it says change your password, put in your password and then hit connect. So the first thing that we're going to talk about is this is going to be your hamburger, and from now on I'll reference it as the hamburger. And this is going to be your waffle, and I'll reference it as the waffle. The first thing we need to do is reset your passphrase, so let's click on the waffle and go to eSign, and then we'll go to key maintenance. You'll need to put in a passphrase that is 10 characters total with one uppercase, one lowercase, and one number. Once you hit enter or accept, it will say it was a success. So we're going to click on the waffle and we're going to go to charts. The whiteboard list is going to give you a list of everybody in the hospital. Due to the fact that I'm putting this on YouTube, I cannot click on that, but it'll be a list of everybody in the hospital. It'll also say if they're observation, it'll say what day they're admitted and who they're admitted to, and it'll tell you what room number they're in. There is a PDF button that you can use to print it out and carry it around if you need to. You can search by name, last name first, no comma, caps or no caps, it doesn't matter. And you can search by number if you know the account number. Nursing is going to give you a list of all of the nursing departments, and you can click and see which one you want to look in. The whiteboard list to me is the easiest, but for today we're going to go by number. And so I have a test patient. So the first thing that we're going to do is click on lab results, and I like to put my lab results in comparative. The newest lab is going to be on the left, the oldest lab to the right. You can also change to the last few visits that you want to look at, or even a date range. All of the labs will be listed, your CBCs, all of your results will be listed, not to where you have to click on them, but for this test I have to click on detail to show you, so you can always click on this. If it does have the word detail, you will have to click on it. Usually the results are listed though. Order chronology, this is all of the orders that have been done, and you'll look at this and see what you want to discontinue. You can also see the history of events that have happened. So I have everything checked. You can always uncheck one of the pharmacy, ancillary, or nursing. Active, that's going to be everything that's currently pending or active as far as meds. All is everything that has been done or has yet to be done. You can sort it by date and time. You can sort it by description. You can search for something by typing it in. Anyhow, you can see if it's active or canceled or pending. So back to the active meds. On the active med screen, you can discontinue meds, you can modify meds, you can change the rate if you want to modify like an IV fluid. Things to remember is if you're given vancomycin 1,000 and you want to change it to vancomycin 500, you would probably need to discontinue and reorder. If you're ordering a tablet, if you want to change the time frame, you can modify. But if you're changing the strength, remember we can't always cut a pill in half. So you may need to discontinue and then reorder it in order entry, and we'll go over that. But those are the things. Using your control key, you can highlight several things at one time, and you can discontinue and process. And once you've got everything selected, you would sign, put in your passphrase. If you want to modify the medication, so let's modify the solution. So we're going to click modify, process. So we're stopping one and restarting it, and so we're going to change the rate. So you'll see one is a stop date at the same time, and one is where rate change. So you would sign that. And you can do all of these at the same time. When it's gray, that means I've got you set to where your passphrase will hold for 1 hour at a time. And discontinuing medications, you would highlight them, discontinue, and process, and then sign. So that is order chronology. My recommendation is look and see what's going on with your patient and see what needs to be discontinued, and not to put in duplicate stuff. I do find a lot of people do not look at this and put in a lot of duplicate things, which causes confusion for the nurse, because on the MAR it'll have different entries, and so the nurse is liable to give a medication or cause a medication error, not knowing that it has already been given and dropped off of her screen. Now we're going to go over order entry. So in order entry, you have order sets and departments. Those are the two that you're going to use. Departments, if you set it to all, you can search. And this will be anything. If you wanted to order a Foley, you can order a Foley. Don't use the actual, just like Foley, catheter. I do have one called blank. If you randomly can't find what you're looking for, just put in blank. So anything that you select, you're going to add to pending, and then you can edit. If you click on pharmacy, you'll see all of our inventory. You can search for it. And as you're adding to your list, everything you're going to move, double click, move to the right, and then you can always click on it and you can edit it. If you want to give 3 doses total, you can put 3 doses. If you want to give it stat now, they'll give it. First dose, if you want to start it tomorrow, it won't go to their MAR until tomorrow. And if you wanted to type any instructions, you can type anything you want to. And you're going to click update. I also have nursing orders, and you can see all the nursing orders. Continuum of care, they only have a few, so if you need to do a case management referral. Physical therapy has physical therapy, order, eval, and treat. That's primarily what you would order. Lab, I recommend searching for the lab. Radiology, again, you can go to all and search for what you're looking for. And just add it to the list. So everything you're adding to the right side of the screen is what you're planning on ordering. Let's click on order sets. Order sets, I have several order sets. If you click on the magnifying glass, I have ER order sets. I have an admission. Let's go over that. The admission order set, I have several. I have a UAMS, OB admission. I have just a plain admission order set. Basically, this is just a compilation of everything that you may need, just an easy way to find it. I need a diagnosis anytime they're admitted, and where to. If you don't normally check it, or if you don't normally write it, don't do it. So if you don't do a condition, just leave it blank. I've added fall precautions, seizure precautions, Foley catheter if needed. Just go through the list. I've added some DVT prophylaxis as just a reminder. And our IV fluid reminder, if you're looking for anything, it starts with SOL. If you need to do a rider, we have potassium riders. If you need to do a 40 potassium rider, you would order 2 20 milliequivalent riders. And I have them listed right here. The 40 we order during the day while the pharmacy's here, and they can mix it. I've just added some PRN medications, Nicoderm in case they smoke, some random labs. On your labs, if you order anything, you can set it for when you want to do it. Do you want to do it in the morning? And x-rays, radiology. I have a CPAP BiPAP as at home in case the patient uses a CPAP and we don't know their settings. Respiratory consult and oxygen if they're going to do an oxygen. It'll give you drop down boxes and I'll show you that real quick. And then our normal diets, anything. So once you've got everything clicked that you want to use, click add depending and it'll move to the right side of the screen. And then you can type everything in. If you want to get a PT and INR tomorrow, you could change the date. So a lot of things have questions. You have to answer the question if it is in red. I also have vent settings. You can type vent if you're looking. And then once you're finished, you're going to click sign. Anything that says stop, there's a clinical monitoring override that we have to go through, and I'll show you that. And anything with bubbles, you have to fill out. So let's look at the bubbles first. So a reason for our chest x-ray. And then we're going to address clinical monitoring. So address clinical monitoring. So over here on the right, there's override reason required. You can click required, and some are duplicate. This is a duplicate. And then we're going to select all, and we're going to override. And we're going to say you're going to select your dose or the reason why, your override reason, and you really need to pay attention because they can be allergic to medications. Your allergies are here at the top if they fit, but they'll also give you drug interactions, they'll give you allergies, so it'll tell you why. So please, please, please pay attention to why that is coming up. Once you're done, you're going to click sign, put in your passphrase, or if it's held, just click accept. Now we're going to go over actually doing a documentation. So let's go to the documentation tab. You would find which header you want to put it in. Do you want to put it as a history and physical, progress note, ICU progress note? It's so the residents can find if they did an ICU note or not. So let's pretend like we're doing that. You're going to go to templates, click that, and then if you click all, you can find what you're looking for. UMS has their own. And if you're using a UMS or Dr. Scal, if you'll add to your favorites, then when you click on your favorites, it will be added there. So back to progress all, because I have several in mine. You'll insert. If there's any drop down boxes, you'll do those here, and then you'll insert again, and then you can type your findings. You can also say vital signs and pull clinical data, and you would select your lab results, and then you can look at all your results, and you can add anything that you wanted into. You can also add markups, which are pictures, and once you're finished, you'll click sign. Put in your passphrase. So as an attending, I want to show you how to sign a resident note. You're going to click on home and you're going to go to the home screen, and so you'll look in your all personal filters, and as a resident signs a note, they're going to put you down as a co-signer, and then it'll come to your queue. So you're going to find a note, click on it, you're going to click edit, amend, and so then you would amend the note. And I have macros built, and if you do a £M, it'll put that you saw, examine the patient, review the resident's documentation. You can use this. You don't have to use it. You can type your own. You can also type underneath this what you would change. We don't recommend adjusting the actual resident's note. Once you're finished, you'll sign. You'll put in your passphrase, or if it's held, it'll be gray. You'll hit accept. You'll arrow back. And as you do these, if the resident has made 4 adjustments, you'll see them 4 notes in here. They'll start dropping away very fast. So I want to go over that one more time. You're going to edit, amend. You can do £M. Read the note, make your changes or your recommendations, hit sign, passphrase, accept, and then arrow back. And that's how you would sign the resident's note. Let's go to e-sign, because you also need to sign the orders. If a patient is a pediatric patient here, the nurses don't give meds per our policy unless the order has been signed by the attending. So these are the orders. You'll need to look through here because if you're a resident or if you're an attending for UMS, you're going to see several queues, and you'll be able to see Dr. Murphy's queue, Dr. Lemja, you'll see what's in there. But you'll only sign the ones that you have addressed, so you'll see them from the residents also. And there'll be a big purple title with their names there. You can select each one, or you can click the SIG button and then process and put in your passphrase. I recommend anytime you're leaving to go ahead and sign all your orders off. I'm also going to give you remote access, and you'll be able to remote in. You might get a text from me saying we need something signed. If you do, it's okay, and I'll help you remote in. Those are the basics of the EMR. And if you have any questions, you have my number. Just give me a call. Thank you.